drugs that we use for advanced non-small cell lung cancer, and specifically the targeted therapies such as EGFR inhibitors and ALK inhibitors, have to be thought about carefully when you combine other drugs with them. Many of these drugs are substrates and occasionally inhibitors of the cytochrome P450 system. For example, erlotinib, which we use quite commonly in EGFR mutated patients, is a substrate of CYP1A2. And CYP1A2 can be affected by a number of things, not only drugs, but also smoking. And so patients who are known to smoke need to be monitored carefully for fear of them having too low of an exposure of erlotinib if they take the drug while continuing to smoke. The other drug that might be a problem in patients taking erlotinib are proton pump inhibitors, and that class of drugs like omeprazole or others can reduce the absorption of erlotinib. There is a question about how clinically relevant that interaction is because patients don't need a lot of drug in order to really inhibit EGFR effectively. However, studies have shown that proton pump inhibitors can reduce the absorption of erlotinib in many patients. When we think about the ALK inhibitors, crizotinib is an important drug in that class as well. It is a cytochrome P453A4 substrate, so patients need to be counseled not to take excessive amounts of things like, or drink things like grapefruit juice, eat star fruits and other kinds of things. Regular orange juice is fine, but some of the more exotic oranges and grapefruit juice need to be thought of very carefully. And of course, there are many other drugs that may inhibit cytochrome P453A4, like some of the anticonvulsants, as well as some antibiotics. And so pharmacists need to be on the lookout for patients and looking at their medication profiles as patients begin crizotinib therapy.